Hi, everyone. This is Jay Evans with Planned Parenthood Texas Votes. Thanks so much for joining our conference call today. We'll go ahead and get started. A few housekeeping items before we do. You're all on mute right now, but at any point during the program, if you'd like to ask a question, all you have to do is hit 0 on your phone, and a screener will take down your name and your question. And then when we have a break for questions, I will call on you, and your line will be unmuted, and you can ask your questions. So now I'm going to turn things over to our Executive Director, Yvonne Gutierrez. Yvonne?
Hello. Thank you so much for joining us today. As you know, immediately following the regular legislative session, Governor Abbott called a special legislative session that began on July 18th. The call for the session included 3 items related to abortion. I know we have been jamming your inboxes with special session updates and requests to take action, and we cannot thank you enough for your steadfast support. It has been incredible. On Tuesday night, the special session came to an end, and once again, dangerous legislation that targets women seeking safe legal abortion and abortion providers past both chambers was sent to the governor and signed into law. I'm going to cover the legislation that passed and the implications from the legislation, followed by the bit of good news that we have to share. So diving right in, despite the fact that the legislature passed Senate Bill 8 in the regular session, an unconstitutional bill that bans the safest method of abortion in the second trimester, and is currently being challenged by the Center for Reproductive Rights and Planned Parenthood, Governor Abbott and Lieutenant Governor Patrick continued their attacks on reproductive health and rights. First, one of the bills that passed is House Bill 13 by Representative Yvonne in the North Texas area. This bill requires duplicative physician and facility reporting of complications that result from abortion, despite the fact that abortion is one of the safest medical procedures in the U.S. Now, following this Supreme Court ruling in the Whole Woman's Health versus Hellerstedt case that struck down certain abortion restrictions that were passed by the legislature in 2013, the state responded by stating their loss in Whole Woman's Health was due to the lack of data. It needed to, quote unquote, prove that abortion is unsafe. So therein followed House Bill 13, which requires a physician to report complications from an abortion to the Department of State Health Services within days of a complication, in addition to the current monthly reporting required by a facility. Now, physicians don't currently report directly to the Department of State Health Services for any other procedure, nor is reporting requirement for any other procedure time-bound by day. So this is a specific attack on physicians that provide abortion. Physicians who do not comply and who do not report a complication in this brief time period will be reported by the Department of State Health Services to the State Medical Board and are then subject to a fine. Now, while the state claims that the information from the report will be confidential and not subject to an open records request, this new law could open the door to targeted attacks on certain physicians should the state want to argue that a certain physician has too many complications in his or her practice. Similarly, the commission could potentially use these reports, so the Health and Human Service Commission could use these reports to target certain or all abortion facilities, arguing that their rates of complication are too high and they should be shut down. And this is, again, despite the extraordinarily low complication rate of abortion. So, again, targets on facilities and physicians specifically. The second piece of legislation that did pass is House Bill 214 by Representative John Smithy from Amarillo. This bill bans private insurance companies from providing health coverage for abortion unless a woman purchases a supplemental policy on top of her existing health coverage. This bill, needless to say, is extraordinarily cruel and dangerous with no exceptions for non-viable pregnancies, fetal anomalies, rape, incest, or the mental health of the mother. This law is not only an attack on women and families, specifically those who are facing medical complications further along in their pregnancy when the cost of the procedure tends to increase, but it is a government mandate on insurance companies. And the idea that supplemental policies will be made available, yet alone purchased, is unrealistic, and we've seen that in other states where this law has passed. This bill, and I've said this to our members of the legislature and other supporters, is really about the haves and the have-nots. And women who can afford a procedure will be able to pay for it out of pocket. A woman who cannot will not. No one plans their abortion, and our women's health champions in the House and Senate did a really terrific job raising these issues during debate. And the bill's author, unfortunately, refused any amendments that would cover the health of the mother, fetal complications, or rape and incest. Obviously, this is a bill that the legislature has been attempting for some time and have finally been able to get it through. Lastly, House Bill 215 by Representative Jim Murphy from the Houston area essentially opens abortion providers up to harassment by increasing reporting requirements by physicians on minors receiving abortion services. We saw in the 2015 legislative session really an attack on minors accessing abortion and where their case could be heard and other restrictions. This specific bill really does target the physician in the facility. Physicians already have detailed recording requirements to document parental consent in a minor's medical record and must keep that record in compliance with the Texas Medical Board rules. And these records can be and are inspected by the Department of State Health Services at any time. There are detailed requirements about minors' consent process already. So this is something that, as we all know, has been in place in the law for some time, and that there are essentially steps involved. This new law requires the additional step of actively reporting the information to the Department of State Health Services as opposed to the department coming into the facility and upon their audit reviewing records. Physicians will now have to report how consent was obtained and if a parent or guardian provided the consent, whether it was at the location where the abortion was performed or elsewhere. For patients who obtain a judicial bypass, physicians would have to report details about how that process was facilitated. And, this is, again, targeting specifically a process that is completely legal. As a matter of fact, all of the documents for a judicial bypass are on the state's website and can be obtained. So essentially targeting a physician or a health center staff person or an advocate, perhaps somebody from James Due Process who was involved in this judicial bypass process is absurd because this is a legal process. But again, this is an attempt to target physicians and advocates and obtain more information about how specifically the judicial bypass process is being facilitated and learn who is participating in this process. So I know that was a lot, and we knew that this was coming, specifically as these three pieces of legislation failed during the regular legislative session when Abbott listed that he would be have 20 items on the call. It was no surprise that bills that had failed during the regular session would certainly be heard and pushed through this special session process. But there is good news. House Bill 14 by Representative Drew Springer from Munster was the bill that would prohibit governmental entities from partnering with Planned Parenthood. And this bill was successfully stalled in the House. This bill would not only have prevented Planned Parenthood health centers from partnering with cities and counties, local hospital districts, any governmental entity in partnership for healthcare services, but also health education, any kind of training, any partnership in work that takes place, say perhaps an effort to educate the community around Zika. So this was a big problem, and obviously the bill that we at Planned Parenthood Texas Votes and Planned Parenthood affiliates in Texas were laser being focused on this legislative session. So stopping this bill was a major victory, but we could not have done it without you, and I cannot say that enough. Our all-hands-on-deck 24/7 approach included action days at the Capitol, getting thousands of petition signatures, lobby visits, social media ads, hundreds upon hundreds of supporter calls, both to Speaker Strauss's office, but also other key members of the legislature. Calls from key influencers, including donors, county commissioners, other folks that are supporters that we know have relationships with members of the legislature. Those were incredibly important and crucial. We also were able to get a letter signed by the mayors of Austin, Dallas, Houston, and San Antonio to the Speaker of the House, addressing that not only is Planned Parenthood an important partner in communities, but the state should not be limiting any city or county's ability to partner with healthcare providers in their communities, specifically those like Planned Parenthood, who provide specialized care, who were such an integral part of the healthcare infrastructure and on the front lines. We also garnered quite a bit of earned media. We got really creative and had yard signs put up in the neighborhoods of legislators and legislative staff. So those of you that agreed to have a yard sign, we thank you. And after years of attacks on women's reproductive health and rights, this was certainly a major victory for us. We know that this is not the end, and by all means, we will need to continue the fight. But we know that we have solid support, not only from our communities and from our supporters, but really throughout the state, and could not, again, say thank you enough for your help. Should there be a second special session, which we know that those rumors will continue until there is action taken by the governor, we are ready, and we will be ready to do this all over again should the need be, but happy to take any questions at this time about any of the pieces of legislation that I spoke about.
So if anyone has a question, all you have to do is just press 0 on your phone, and a screener will take your question, and then I will unmute your line, and you'll be able to ask your question to Yvonne. So we'll give folks just a few minutes to go through that process, and anyone who joined us late, as I was mentioning, all you have to do if you'd like to ask a question is just hit 0 on your phone, and a screener will take your question. I'm not seeing any now, so if at any point you'd like to ask one, that's fine, just press 0. So right now, I'm going to introduce Sarah Standiford. Sarah is the State Campaigns Director for Planned Parenthood Action Fund, and she's going to give us an overview of the national landscape, especially in the weeks and months since the Affordable Care Act repeal efforts, and a preview of what the national office as well as state offices are doing to build grassroots momentum focused on the next fights ahead of us. So now I will turn it over to Sarah.
Hi, everyone. Thanks, Jay. As you said, my role is a state campaigns director at CPSA, and so I have the good fortune to work with Yvonne and her team and the other organizations and affiliates across the country who are really waging immense and amazing fights in order to protect our patients and protect care. I want to talk a little bit about the national picture and how what is happening in Texas really fits into that, and about what's next. And also just commend and lift up the work of PPTV, because it really is having an impact beyond the state. So first, as I think in the weeks and months after the ACA repeal and failed Planned Parenthood defunding vote in Congress, there's still a lot of work going on in states to fight back. And really, the fight in Texas, particularly around the defunding bill, is so important not only to maintain what services we can, but also to contribute to this national narrative that the public opposes defunding Planned Parenthood. We're going to continue to drive media coverage demonstrating that the public is with us, and that's why the rallies in Texas, the lawn signs in Austin and elsewhere, really help echo that narrative throughout the country. We need to build into national consciousness a lasting impression that Planned Parenthood defunding hurts women, is immoral, and that widespread opposition is evident. Texas has really been the center of the storm, as I know you know, and frankly, a warning to other states. And as part of this fight, and as part of your fight during session, really lifting up a commitment to intersectional fights that strengthen our allyship and increase grassroots capacity at every level, including fighting back against bills that, for example, discriminate against transgender Americans, which I know you've been very much a part of. And our goal has to be to reaffirm always that we will provide care no matter what, that we're fighting to keep our doors open, and that we're doing everything possible to mitigate harm to our patients. So that's where we are. What we have the opportunity to do now is to build and really leverage the grassroots action, the immense outpouring of support, and make it a sustainable momentum focused on the next fight, not only in Congress, but as Yvonne alluded to, the 2018 and 2020 elections. Because this is really our chance to change the landscape in our favor, both incrementally and pretty dramatically in places. So we want to work with you to leverage this, as I said, unprecedented grassroots support towards ongoing fights, launch new focused campaigns that channel this momentum, find wins where we can, wherever we can, at every level, and build capacity. So I know that PPTV has always been at the front and center. At PPFA, we really commend Yvonne, her team, the affiliate and state office team who have been fighting, winning in very unexpected ways, even when the odds are stacked against us. And I really want to lift up these unexpected wins, which I know, even though, as I always say, we like to have high hopes and low expectations. Yvonne has had high hopes and high expectations for her team along the way, and I think really delivered on a promise to use every lever, including grassroots, lobbying, engagement at every level, to eke out a couple of really important wins this session. So thank you.
Thanks so much, Sarah. If anyone has any questions for Sarah, all you have to do is press 0 on your phone, and the screener will take that question for you. Any folks just now joining us, we're happy to take questions for Sarah, who does great work at the national office and really supports us in our work here in Texas. So all you need to do is just press 0, and a screener will take your questions for Sarah. So I think Susan Smith from San Antonio, you have a good question for Yvonne. I think that will lead us into the next part of our conversation about what's next. And so, Susan, go ahead and ask your question that you had for Yvonne.
Okay. I just wondered what happened to the fetal burial bill and at what point it was killed, as I assume it did not pass. I didn't see that it passed. I wondered what the dynamics were to bury it, if you don't mind a pun.
Hi, Susan. Thank you for your question. So it's an interesting trajectory that has now happened with the fetal tissue burial. So a regulation, a rule came out of the agency earlier this year that would require the burial of fetal tissue. At that time, the Center for Reproductive Rights challenged the law and did receive a temporary restraining order against the bill essentially going into effect. However, during the regular legislative session this year, there was also a little bit different language, but essentially the same concept of a fetal tissue burial was part of Senate Bill 8, which is the bill that was the restriction on the second trimester abortion. So now the Center for Reproductive Rights is going to be adjusting their current challenge to address the language that was now passed by the legislature. So it is a kind of a twofold effort of both challenging the regulations and challenging the new law. And so that this fall or late this summer, I guess, depending on how that ends up falling in September, there will be the court will readdress the issue. But I'll certainly be able to provide updates as we receive them. But it is a bit complicated, so I know that was an interesting one to follow. But thank you for your question. So, and that I feel like leads into the next section, which really is what is next. So, as I mentioned earlier, we are unclear whether or not the governor will call a second special session. As you know, two of his top priorities were not passed, which was property tax reform and the quote-unquote bathroom bill. The governor has essentially alluded to the fact that there would not be a special session, but he couldn't make any guarantees. However, we are now dealing with a ruling that has come down from a three-panel federal judge that that there had been discrimination in the maps that were drawn in 2 congressional districts, and that those maps would either need to be redrawn or the court would draw them for the state, which could then trigger a second special session in which the governor could add other items to the call, the 2 that I mentioned that did not pass, and as well as the Planned Parenthood defund effort at the local level. So we are watching and waiting. Attorney General Paxton has to reply essentially to the court today in regard to the state's decision, but he has said that he plans to appeal on this redistricting ruling from the 3-panel judges. So we are in a watch and wait moment, but on that end, but that does not stop our work. In regard to litigation, as I mentioned, the second trimester abortion ban that on a specific procedure that we saw pass in the regular session is also currently being challenged. So there are, as Susan mentioned, the fetal tissue burial legal challenge, as well as this second trimester abortion legal challenge that are in the works currently. So we will be following that and making sure we are keeping you all updated on what the next steps are, and certainly giving you an action opportunity as we always do. Also, next week we will be launching a Pledge to Vote campaign. This is really an effort to say this second special session and Governor Abbott and Patrick's deliberate and really dangerous attempts to further restrict access to abortion, some that have passed. This is an opportunity to say we have plans for 2018 and we have plans to make our voices heard on a number of issues. So that will be launching with a full-fledged campaign that will be taking place online at community events and really across the state. So more to come there, and also we'll be gearing up for 2018. The primaries are right around the corner. We are never working too early on what is next in the next election cycle, and certainly working very closely with our allied partners throughout the state and in the cities in different efforts that are going to be very important to our voter outreach and education opportunities. So that is what we have. Wanted to share with you in a timely fashion immediately following the legislative session. I'm happy to take any other questions that you may have.
So we do have a question from Evelyn in Houston. Evelyn, go ahead and ask her a question.
Hello. I would like to ask more information about the legislation requiring separate insurance for abortion services, such as, is there any other state where this has already gone into effect where we could see what the likely outcomes are? What outcomes are expected if it were to happen, other than just people who can't afford it not doing it? Would that lead to likely further shutting down of abortion service providers in Texas? And is there any recourse besides electing different legislatures? Thank you.
Thank you. That's an excellent question. So we have seen in other states in which either insurance companies decide not to offer a supplemental policy, or they do offer a supplemental policy, but because there is lack of awareness, and as I mentioned earlier, no one plans their abortion, that there is, not certainly huge participation in adding that requirement, which we know is very dangerous. And when, these situations occur in which a procedure is costly or it's an emergency medical situation, and the procedure is not covered, we will see families who are going into medical debt because they are not able to pay for this procedure. In regard to your question about lack of access, so this is not really a question about access. It is a question of access for women who can't afford the procedure. But as far as the facilities themselves and being able to provide the care, that is not currently really kind of part of the concern around this bill. But as I mentioned, it is really particularly for women who and families who would have difficulty paying for the procedure. In regard to anything that we can do about other than electing other leaders, there are opportunities, and we certainly, which is why we ask for phone calls and petitions and emails, et cetera, for us to stop pieces of legislation. But as we've seen over the last 6 to 7 years, it has been incredibly difficult to stop these restrictions and attacks on women's reproductive health because we are just, anti-choice politicians are essentially in the majority and in the leadership of the state. So unless we are working long-term, really